Hello and welcome to HIMSS TV's Deep Dive on Interoperability. The free flow of data across organizations has been a persistent challenge for the healthcare industry, and the recent strain on providers is only highlighting the difficulties data incompatibility introduces. The Office of the National Coordinator for Health IT may have postponed the compliance deadlines for some of its long-awaited interoperability rules, but that doesn't mean that these capabilities won't bring major benefits to those who need it most.
For us to be able to fulfill the promise of engagement, patient engagement, and capabilities, we really need to have interoperability. The faster we can free up that exchange, the better. So the focus point on interoperability has been gaining a lot of momentum in the last 2 years because we're getting closer and closer with opportunities like HL7 Fire, the use of Continua. There are standards that are out there and we need to continue to refine them.
Hope that interoperability is reaching its last mile only comes after years of expensive trial and error. Although early efforts out of the federal government may have been misguided, shining a light on these mistakes provides a new roadmap towards lasting change.
We've had to work through iterative processes to learn the lessons that it takes to get to that point. We, in the course of my service, we pursued aggressively the idea that let's get language where people can begin to exchange information. And our approach was that we would try to get all of the vendors to coordinate the way their systems worked. It was the wrong approach. We now know that. It is an iterative process that we have learned by. These rules now basically say, let's use the power of consumers. Let's create APIs that people can submit information in a standardized way. And by doing that, we'll see the power of consumerism reshape this. That is a transformative idea, and we had to learn these lessons.
Much of the focus on health data interoperability has, understandably, been on health organizations, but many of its benefits are best found outside of the hospital's walls. The past few months in particular have highlighted the need for easily accessible post-acute care, as well as the systems that enable it.
That interoperability is actually essential. It's not a nice to have, it's an absolute must have. And it's really driving a tremendous amount of intensity. We're now seeing that folks are recognizing this is really, really important here, both for infection control, but also speed of diagnosis and treatment. Now that patients are being released from the hospital and are moving from the category of treatment into post-acute, some of those patients now require continued imaging, right? And we recognize that, unfortunately, with this disease in particular, while in the US we're not using imaging for diagnosis, we do other parts of the world, but in the US we're not ready to do that yet. We know the clinical effects of recovery from this disease affect multiple other organs, and it's not just your lungs, but it's your heart and it's your kidneys and et cetera. And imaging and follow-up for both monitoring as well as ongoing treatment, as folks are starting to recognize, I really have to have that, and I really have to have access to it, whether it's exchanged, transferred, or I view it outside of the facility. This is a really important part of interoperability.
Providers need to have access to their patients' records to make appropriate care decisions. So it's little surprise that many doctors will point to disparate EHR systems as a major contributor to burnout and stress. And that's not to mention the frustrations these shortcomings introduce for patients and public health teams.
I got to Washington, with sort of 20 years of clinical medicine and the frustration on the physician side of making decisions sometimes in the dark because we didn't have the actionable information that we needed, whether it was in the clinic or the hospital or even on call after hours. And all those frustrations for my patients who had to take off work again or take a couple of buses again to get down to see us. And also a perspective about public health from a time when we were rebuilding our community in New Orleans after Katrina and saw the importance of having data in times of disaster, but frankly, for every day.
Although physicians are among the first to call for a greater focus on interoperability, the organizations they belong to aren't entirely free from blame. In a competitive healthcare environment, there are strategic advantages to holding all the cards, or in this case, all the data.
People in the healthcare community, there's a little bit of competitive control that they want to have over their information. So they don't necessarily want to share because they want to keep those patients within their own system.
That's interesting.
That's my interpretation. But
why do you think that is?
well, it's competition. You know, we have a competitive system. Every healthcare system is going into bigger and bigger systems. They have a much better opportunity to keep their own universe, and they do that by keeping the data and making it difficult to share that.
The push for health data interoperability has developed parallel to another major movement within healthcare, the shift towards value-based care over fee-for-service. Here again, systems seeking greater outcomes and the reimbursement that comes with them will greatly benefit from data-driven care coordination.
How do we get information to providers in a way that they can make better decisions about the patient, the right patient at the right time, having that information? And the care coordination is really it's the key component, the information that they'll have. And when you talk through that and you have the right information, you also have the idea of being able to make more responsible decisions around quality of the care, and therefore what government's looking for is what's known as value-based purchasing. So they want to pay for value, not volume. For many years, healthcare has been really paying for every time a patient walked through the door of the hospital or the provider got their payment. The government, want to really pay for not the number of times, but the quality of care that's received.
COVID-19 has flipped the healthcare system on its head, and interoperability is no exception. The emergency has outlined new areas of focus for health data stakeholders who have so far found current pandemic response information capabilities to be lacking.
As you can well imagine, COVID-19 has created a flurry of activity in the interoperability community. And a lot of that has been driven by your standard public health data type needs. So I think one of the long-term impacts for interoperability policy in the U.S. is going to be taking into account pandemic response type issues that we're seeing now. There's already a lot of groundwork out there and a lot of momentum for building event notification type services. So I think that based on what's happened with COVID, we're going to see a lot more emphasis on leveraging national networks such as Commonwealth and leveraging event notification services to provide updates for patients, allow them to track their own care progression, and allow public health researchers to interact with what's going on with the patients out there. That's all future, I think, work that is going to come out of this.
With each passing day, it's becoming clear that providers and other stakeholders are no longer willing to deal with disparate EHR systems. They're being exposed to new healthcare delivery tools that can only function with unrestricted data sharing, and they're beginning to choose business partners that can make that happen.
Interoperability in general has evolved dramatically in the last year, especially between acute and ambulatory care settings and other out-of-hospital care settings, such as the post-acute provider markets as well. I think providers in and out of the health system are recognizing that there are many more opportunities to connect. Last year, we conducted a research study with Porter Research, asking referral sources about their attitude towards interoperability with out-of-hospital care providers. And I think the results were absolutely astounding. Greater than 60% of referral sources surveyed indicated that they would switch post-acute care delivery partners if those post-acute care delivery partners had the opportunity to interoperate with them.
Thank you for watching the HIMSS TV Deep Dive on Interoperability. This has been Dave Moyo, signing off.